My name is Liliana Prakasam, family nurse practitioner and doctor and nursing practice student at Brandman University. I am presenting my innovation project, the mobile app to improve diabetes type 2 self-management. What is the problem? Type 2 diabetes mellitus is a worldwide disorder that requires multiple specialties and self-management to control it. Since patients provide most of their own diabetes care, patient self-management training is an important factor to improve the quality of care. Diabetes affects 25.8 million people in the United States, which represent 8.3% of the population. California has the greatest number of new cases of diabetes annually. 1 in 7 adult Californians has diabetes, representing 3.9 million of people, and about 11.4 million people in California have prediabetes. Ethnic minorities and those who are poor or disadvantaged have especially high rates of diabetes. In 2012, the cost in US exceeded $300 billion, compared to 2007, where the cost was $174 billion. California has the highest cost of $27.6 billion. Diabetes is the leading cause of blindness, amputations, and kidney failure, and is a major contributor to heart attacks and strokes. These complications can be preventable. Besides providing medical management, multiple efforts have been done to promote strategies that support and reinforce healthy behaviors and improve the environments where people live, work, study, and do social activities. This conventional management still remains ineffective. Multiple studies have been done to identify the barriers to self-management of diabetes. The lack of interest, poor food choices, lack of motivation to exercise, inadequate health literacy, lack of awareness of target blood glucose levels. Collaborators on my proposal. The mobile app creator. He helped me to understand the technical and social issues of using technology in the healthcare system. He said that some people view development of innovation projects as difficult. His advice is to build credibility, encourage collaboration, and to provide internet resources. The physician is very engaged in evidence-based practice, and he is willing to implement the mobile app into his practice as long as the app follows the ADA guidelines and patients are willing to use it. His main concern was about the ethical issues of confidentiality when emailing results. The Hispanic patients with diabetes type 2. He was not exposed to technology before, but he was able to use the mobile app after one-to-one training. He was very pleased to see the chart with the fluctuation of his blood glucose, and he was very surprised to see how many calories he was consuming per day. I chose them because they had diverse backgrounds and may view the problem from multiple perspectives. Why is my proposed solution innovative? Tracking blood sugars and insulin dosage with a pad and paper doesn't provide patients with a trend of what is working or what is not. Mobile technology are powerful tools that have tremendous potential for the self-management of diabetes and will enhance patient-provider communication by promoting engagement, decision-making at both parties to improve health outcomes. The new era of self-management. Mobile devices are a great opportunity through which to improve accessibility and use of a self-management site. The mobile app that I have chosen to my project is the Diabetes Lite App. The purpose of the app is to help patients to manage diabetes by tracking the factors that influence blood glucose level and do adjustments according to the results. The mobile app logs glucose levels, insulin injections, medications, and blood pressure. Manage activities and exercises. Manage glasses of water consumed for the day. Also track weight and BMI changes. Other important key features: budget daily carbohydrate allowance, retina display, backup and restore over Wi-Fi, integrated with Twitter, use passcode to protect data. Also support both US and SI units. Will age be a problem when implementing my mobile app? My mom is 90 years old. She navigates through the internet with no problem, and she has a Facebook. She didn't have any problems using the Diabetes Lite app after proper training. My granddaughter, she is 4, she knows how to use her iPad. She has her favorite apps stored and she decides which one to watch. So, I believe that with proper training, anybody can be taught and using mobile apps and technology in general. Clinicians and patients are becoming more aware of the benefits of technology in healthcare promotion, prevention, and intervention, having the possibility to bridge gaps in diabetes healthcare and improving the connection between patient and provider. Thanks.